Hey everyone, it's Dr. Porter with Traverse Health. Today I'm going to talk to you a little bit about carpal tunnel syndrome. So it's one of the most painful and disabling conditions in which mobility or the function of median nerve is restricted as it passes through the wrist. But the median nerve is not the only nerve that extends into the hand, and there are other entrapments of other nerves that can produce symptoms very similar to carpal tunnel syndrome. So the first one we're going to talk about is ulnar nerve entrapment. Ulnar nerve originates in the neck from the C8 and T1 nerve roots, so down kind of at the base of the neck. It's the most common entrapment site in the inner elbow, which we also call this Guillain tunnel syndrome. And the ulnar nerve also innervates the pinky and outer half of the ring finger, so just right in here. And that's where numbness and tingling are felt, especially if you get hit right on the funny bone area. And sometimes even with this type of syndrome, you'll have a weakness of grip. You're not really able to pinch as well with these last two fingers between your thumb. Another one is the radial nerve, and it innervates the back of the forearm and outer hand, and also deals with wrist extension. So this movement right in here. So if you have weakness in that area, then it might suggest you have a radial nerve entrapment. And the radial nerve can be pinched in your armpit, and sometimes if you're using a crutch for too long or improperly without padding, you can kind of have the same thing where you'll have numbness and tingling along that radial nerve into the back of your hand. Another type of injury is kind of a brachial plexus injury. And the brachial plexus is a group of nerves that arise out of your neck and control all of the nerve function and muscle function in your arm. And it's a lot less common to have an injury here, but they can affect the entire arm. A pretty common one is called Erb's palsy, and it happens pretty frequently when there's a difficult birth. For example, when the baby has to come out the birth canal and then you tug on the arm, it can really just stretch the baby's arm out like this, and then you might see somebody walking around like this. We call this Erb's palsy. You may observe some of these various nerves innervate different parts of your hand and finger, which helps us as doctors of chiropractic identify where the nerve is entrapped. Once this is established, we can administer tests along the course of the nerve to identify the areas where nerve mobility or function might be restricted so that we can figure out a treatment plan that's going to help you. To complicate matters, nerve entrapment can occur in multiple areas. Likewise, a patient can have entrapment neuropathies in two nerves simultaneously, which may require a more comprehensive approach to resolving your symptoms. Doctors of chiropractic have extensive training in anatomy, physiology, and pathology and are clinically trained to differentiate, identify, and treat these various conditions. There are many non-surgical treatment options offered by us, including laser, decompression, injections that can help you throughout your healing process and not only limited to just manual manipulation. Again, this is Dr. Porter and Dr. Pound with Traverse Health, helping you heal better fast.